Liposuction is a topic that I frequently get asked about, and specifically, patients come asking for reduction in fat in particular areas of the body, and for those patients, liposuction works really well. Most people are familiar with the concept of liposuction. The idea is really to remove some of the fat cells in areas that are a little bit bigger, where you'd like a little bit of volume reduction. Best candidates for liposuction procedure are patients actually who are overall quite fit and really have specific problem areas where they would like to reduce the volume a little bit. Liposuction actually isn't really used for just general overall weight loss. I occasionally have a patient who comes and is a little bit overweight and would like me to sort of reduce them overall. And liposuction, unfortunately, isn't really a great choice for that. For that, really the best choice is diet and exercise. But for patients who have gone through diet exercise and really, everything looks pretty fit, but there's just one area, let's say the abdominal flank areas or just your upper or lower abdomen, where they really can't get much improvement, liposuction is a great choice for them. In addition, liposuction, since by virtue of what we're doing, it's really reducing the fat in the area, it's really used for areas where there's no extra skin. So if people have excess skin that's sagging, in those people, typically there's a different surgical procedure, either a tummy tuck if it's the abdomen, or another associated surgical procedure. Procedure itself is straightforward. It's basically done in two steps. The first step is to insert into the area of liposuction sort of this tumescent fluid, and that's really a fluid that is a combination of a painkiller to make it more comfortable for the patient, as well as what's called a vasoconstrictive agent, which is an agent used to shrink the blood vessels to ensure that there's less bruising. That's what I typically use. And then afterward, giving this time to take effect, then really going in with the liposuction cannula, which is sort of almost like a metal straw, and essentially just kind of slowly and carefully taking out the fat cells. The trick in liposuction and the important part of liposuction in terms of the surgical technique is to really try to get a nice reduction where the ultimate goal is very smooth and looks natural with the rest of the body. You don't want to take too much fat out of one area and have it be out of harmony or out of sync with the rest of the body. At the same time, you don't want to take out too much fat such that there are any irregularities in the skin. And I think that typically, as with most aspects of plastic surgery, if you are conservative with your goals and conservative in the execution of the surgery, the results can be quite nice. Post-operatively, patients do have a lot of dressings on them. I have my liposuction patients wear a compression garment afterward. It's basically something that I have them wear that's quite tight, and the idea is to really push on the skin so that the skin will kind of shrink wrap a little bit over the smaller volume. What we don't want is for the fat cells to be removed and then the skin to just sag because it's not as filled up now. We want the skin to actually contract and kind of shrink wrap around it, and the compression garment is very good for helping that. I have patients wear the compression garment really almost all the time for the first 2 weeks, and then as much as they can for the first 6 weeks. After that, body does continue to remodel, and the results do continue to improve. Overall, I think that patients after liposuction, I encourage them after the surgery to use that sort of as a kickstart to resume good diet and exercise.